All right, so the first test we're going to do is the Kim test. For this one, I'm going to have my patient sitting, just sitting regular with her arm abducted to 90 degrees and her elbow flexed to 90 degrees as well. And I'm going to hold the elbow and the lateral proximal arm. And I'm going to apply an axial force through the humerus. And then I'm also going to raise the arm at a 45-degree angle, and I'm also going to pull the humerus backwards, so like this. And if she has any pain or clicking during this, that would indicate a posterior inferior labral tear. And so the next one we're going to do is the jerk test. For this one, my patient's going to be sitting again with her arm abducted to 90 and her arm internally rotated. And I'm going to grab the patient's elbow and apply an axial force through the arm while horizontally adducting it. So like that. And if she has any pain or sudden like clunks, as that humeral head subluxes posteriorly, that would indicate a posterior inferior labral tear. So the next one is the apprehensive test, and she's going to be lying supine for this one. And her arm is going to be abducted to 90 with her elbow at 90 degrees of flexion as well. And I'm going to support the shoulder and then externally rotate her arm. And I'm going to be looking at like her facial expression, seeing if she is apprehensive or is in any pain before that endpoint is reached. And if she does have any pain, or I can see that she's apprehensive to that, that would indicate anterior instability of the shoulder. Next is the Jobe relocation test. For this one, she's going to be in the same position, arm abducted, full external rotation, and then her elbow flexed to 90 as well. And I'm going to have one hand on her wrist, and then one hand over the anterior humeral head. And I'm going to externally rotate her shoulder and then apply a posterior force on that humeral head. And if this reduces any of her pain, and this allows her to externally rotate more, that would indicate that she does have anterior instability. And this test needs to be done immediately after the apprehensive one. And so after the apprehensive one, we're going to do the surprise test. And for this one, my patient's going to be lying supine again with her arm abducted to 90, elbow at 90 degrees of flexion as well. And so I'm already going to have my hand on the anterior part of her shoulder, and I'm giving that posterior force through the humeral head, and I'm just going to release that with her arm still in external rotation. And if she is apprehensive to that at all, or that increases her pain, that would indicate anterior instability as well.